Carolyn, like you know, caregivers are so important in patients' healing journey. Everyone needs to have someone help support them to ensure they get from an open wound to a healed wound. Can we talk today a little bit about how caregivers are so important in the care of our patients? With keeping appointments, how do you see that caregivers really impact the appointments?
Boy, we all need an accountability buddy, right? And keeping appointments is crucial in the wound healing journey. Mm-hmm. Very important that we have that appropriate visit cadence in order to allow us as caregivers to monitor what's going on with that wound. And the caregiver may be involved in setting up transportation, they may be involved in coming to the appointment with them, which is a huge help and support to the patient, because now they're going to know what needs to be done in between those very important visits.
So talk a little bit more about the caregiver's role in supporting the dressing changes, as you were saying that happens so frequently between visits.
You know, one of the things that might be a problem for some of our patients is they're overwhelmed with all of this information around not only their wound, but the underlying conditions that they have that might be preventing the wound from healing. Having that extra set of ears with you at that appointment could really help. Once you get home, you might not remember, and you might have lost your paper that has your orders on it. Now you've got someone else that can help you and then guide you through the dressing change, or maybe even be there to change the dressing for you.
Those are some really good tips. Are there other things, such as promoting those healthy habits, that caregivers would really be an impact for our patients?
And this is where that accountability buddy really comes in handy. So making sure that you're sticking to that diet that might be prescribed by your primary care provider, and then we are supporting that as well. Nutrition is a huge part of wound healing. Without proper nutrition, the body just doesn't behave like we need it to behave in order to heal that wound. And so having that person saying, you know, you need additional protein, or you know, we shouldn't probably have that extra snack, sugary snack, in between meals. That's that accountability that caregiver can really help reinforce.
And some of that accountability is also the cessation of smoking, as we know that impacts wound healing so much. What can caregivers do if they're overwhelmed or patients are overwhelmed? Any suggestions for the caregivers of how can we help support our loved one through wound healing?
We are here for our patients. We're also here for the caregivers that are responsible for those patients. And so a call to us, a quick chat at the visit, at the end of the visit, and we can help support you in many different ways. And sometimes it's just needing to talk to someone. It's not necessarily, what do I do? It's just, I need to talk a little bit about how challenging this is for me.
Thank you so much for sharing how important our caregivers are in the patient's healing journey.